In the fall of 2020, my grandfather, a nurse of 20 plus years, the man who had been my father throughout my childhood, was diagnosed with pancreatic cancer. After surgery, a brief period of remission, and short lived time of relief, later scans revealed that the cancer had returned more aggressively, and this time in the liver as well. Against what are now my previous desires, he chose to decline chemotherapy, which is the most common treatment for cancer. I couldn't comprehend why he wouldn't want to be treated with chemo, so I did a bit of research. Surprisingly, chemotherapy was discovered almost by accident by the US Army in World War II, while they were conducting studies on chemical agents used in war. These studies became catalysts for research of other effective agents that would kill rapidly growing cancer cells, as explained by the American Cancer Society, which is today known as chemo or chemotherapy. I'd like to share some of my findings with you all. First, many cancer patients choose chemo because of how it works and its ability to efficiently reduce the size of cancerous cells. Second, it has several convenient personal and cost-efficient benefits for some cancer patients. Lastly, there are substantial negative effects of chemo, which is why it may not be the treatment for everyone. So, what is chemotherapy? Chemo is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Your eligibility for chemotherapy is heavily dependent on the condition of cancer in the patient and the state of that cancer, meaning the type and stage of cancer between stage 0 and 4, with 4 being the most advanced stage of any particular cancer. However, majority of patients still end up with the option of doing chemo. Chemo prevents cells from dividing and multiplying. Cancer cells themselves multiply faster than any other cells in the human body. So with these drugs, the production of cancer cells is successful in successful cases, are reduced drastically, and even stopped completely in some cases, which is the best outcome, or cured. Unlike radiation or surgery, which target specific areas in the body, chemo can work through the entire body. It can cure, control, or treat symptoms of cancer. Chemo drugs can be used alone or in combination with other methods to treat a wide variety of cancers. It can be used to shrink tumors before radiation therapy or surgery. They can destroy remaining cells after surgery, or even make other therapies like biological or radiation therapy more effective, as explained by the WebMD Cancer Center. So now that we know a little bit more about chemo, why do some people choose this therapy? Many people, I believe, choose it for their own personal preferences or cost efficiencies. Beginning with personal preferences, people don't want to go under the knife. They don't want to go under surgery. It's quite invasive with a few drawbacks, one being recovery time, which can take anywhere from a few weeks to a couple months. And because chemo can be the sole treatment for some cancer cases, patients choose this method. It's also very convenient to be able to schedule sessions with your local hospital to do your chemotherapy, or take prescribed chemotherapy pills from the comfort of your home. In a hospital setting, chemo is administered intravenously, where drugs are given via IV bags. At home, patients can take treatment orally as pills, according to Medical News Today. The second reason is cost efficiency, which is a major factor for anyone choosing their treatment for cancer. Looking through data collected by the National Cancer Institute, specifically for pancreatic cancer, the initial costs of chemo start at a baseline of around $2,000, with a continuation cost of about $200 and the final round of about $1,100. However, on average, across the board of all different types of cancers, there is an initial cost of about $57,000, a continued cost of $73,000, and a final cost of $57,000, making chemo for pancreatic cancer actually one of the most cost-efficient chemotherapy treatments, according to these estimates. Even with the increased rates of success in chemotherapy, a large population choose not to go this route. But why is that? It's largely in part to the negative effects that it has on the body. Physically, Chemo has the most common side effects of hair loss, nausea, vomiting, with some more serious side effects like nerve damage, bruising and bleeding, infection, and even a weakened immune system. The list actually continues on, and there are so many um, side effects to chemo. However, one of the most critical effects is that of the mental state. The mental toll of prolonged pain on the body is really undescribable. Patients are in weakened and vulnerable states, and over time begin to deteriorate mentally, leading to depression and suicidal thoughts. Many patients actually lose the will to continue treatment and live. Cancer patients are at a higher risk of suicide compared to the general population. In fact, according to statistics provided by the National Center for Biotechnology Information, they are at 4.4 more times likely. Among 8.6 million cancer patients, about 13,000 commit suicide, making the rate of suicide 29 in every 100,000 persons per year. In the graphical data, these numbers are broken out into specific cancers that the patient had, as well as the time frame of mortality rate that occurred. So between 0 and 1 year, 1 to 5, and 5 years, as seen in the graph. Knowing the drastic effects of chemo and the toll that it takes on the mind and body, many cancer patients are just not willing to choose chemo. They would much rather find another treatment or live out their remaining days to the fullest. So when considering the option of chemotherapy for cancer, as humans, we can be emotional creatures, wanting to opt into anything that may increase survival rate of cancer, whether it be in oneself or of a loved one. However, we need to consider the factual knowledge available to us and respect the decisions of the patients. Chemo can be very effective in reducing the production or even killing the production of cancerous cells, and may be a convenient choice for many cancer patients because of their personal preferences or even its cost efficiency. However, though in many cases effective, chemo may not be the treatment for everyone due to its wide range of negative effects. For my grandfather, it's not the next course of action. In his years of experience as a nurse, he has seen a number of chemo patients and I'm sure has made the best choice for himself. After taking the time to learn, I now respect and admire his wishes not to undergo chemotherapy. Thank you.